Welcome to Beauty and the Brain with your hosts, Dr. Chris Croley and nurse practitioner Jerry Drinkard. Get ready to dive into the latest in revolutionary treatments, cutting-edge devices, and wellness secrets. Whether you're a consumer or provider, we're here to empower you at the forefront of beauty and aesthetics.
Hi, I'm Dr. Chris Croley. Welcome to another episode of Beauty and the Brain, the podcast where we discuss all things aesthetics.
And I'm Jerry Drinkard, family nurse practitioner. Together, and I, Chris, own Skin and Tonic, a med spa located in Pace, Florida. And we're super excited to have a guest on today that is going to talk about some things that you guys have been asking us a lot about. And I'm very excited for her to convince me that I need, because I'm not a fan of cold. So we're going to be talking about cryotherapy.
I know we know nothing about cryotherapy, and I know that I hate cold as well.
The polar plunge always sounds fun just because it's such a social event, but I'm not sure that I can do it.
Yeah, it doesn't sound fun to me at all. So we are going to welcome Dr. Krista Bryars, owner of CryoWellness, in just outside of Des Moines, right?
Yes, that's correct.
We met Krista on The Block. So a lot of you guys know that Jerry and I filmed The Blocks, and it's going to be released here in probably a couple of months. So we're excited about that.
It'll be coming out in the fall. I think in October is what we've been told.
Yeah, probably somewhere there a little bit later. But we met Krista while we were filming The Block. So it's a great show full of entrepreneurs. And as we got to know her and hear about her business, we also got to meet her husband, who we found out the entire family is from this area, just outside of Bay Minette, so Hubbard's Landing.
Yeah, and so my family, they vacation there and tend to go a couple of times a year. So it was kind of nice to be that far away and to make connections with home. So we're happy to have you with us today.
Thank you for having me.
So let's just jump right in. So I know that your background, I mean, you have so much training and so much knowledge. So I'm excited to learn from you today. We also discussed just before filming that you were at Rush University for a while. So kind of where I got my start in medicine. Yes. So we kind of didn't overlap. I think you were there starting about a year after Jerry and I moved from Chicago back to Florida. But outside of that, you have your doctorate in physical therapy, and you have quite a number of certifications and really specialize in lymphatic massage and cryotherapy. I mean, the list goes on, but I know that most recently that you've opened your CryoWellness studio. I'll get the word right by the end of this podcast, I promise. It's a mouthful for me today.
It doesn't roll off the tongue as good.
Yeah. But you opened that most recently, and so that's what you've really been focused on. So tell us about how did you get interested in cryotherapy and decide you want to build a whole business around it?
So I've been a physical therapist for 15 years, and ice has always been prescribed, recommended for areas of inflammation and pain, but really ice packs don't penetrate tissue that deep to be really that effective. I was introduced to localized cryotherapy, I don't know, maybe like a year and a half ago. And I just thought it was so wild how the localized cryotherapy could be really effective for areas of aches and pains, but used for more prolonged periods of kind of a targeted fat reduction. So what I'm doing is a little different than what people think of at the whole body cryotherapy chambers, where you step into something. I'm using something that's a little more localized and kind of a targeted approach to address areas of pain, and also when used for prolonged periods of a targeted fat loss.
Excellent. So would you say that the majority of your patients are coming in for pain conditions or for fat loss?
I see a lot of people for lymphatics, to be honest, and I use the cryotherapy part of it an adjunct. I do see a fair amount of people for pain. So that's where I use my skill set as a physical therapist to address some of those areas of pain, and then some targeted fat loss also, and then combine it with some lymphatic drainage. And then I like to use the cryotherapy also. I do this like facial sculpting, so really addressing the muscles of the face, what I kind of call drain, lift, tone, sculpt. And then I use some of the cryotherapy around that also. So I try to incorporate some cryotherapy into basically almost everything I do in some capacity.
The cryotherapy is like very new to me. And so kind of tell us just the basics, kind of the 101 on how does it work?
Sure. So cryotherapy is cold, essentially. And the cold, the idea of it is bringing blood flow in and then pulling out like inflammation with some of that, just the blood exchange with that. So the vasoconstriction and then the vasodilation that comes in to pull out inflammation and the blood flow and getting blood in and pulling bad things out, more or less.
Excellent. I mean, I love the idea of having this for targeted fat reduction. I need to come and just, spend a week with you and let you just do my whole body.
I've seen you. You don't need that.
Yeah. What is the treatment series? So, I mean, I think people are familiar with some of the more like branded things, and maybe they know the terms like Cool Sculpting, I think is a big brand that uses cold for targeted fat reduction. But there's other things out there that people can use other than Cool Sculpting. I think that's the brand that people are familiar with. Am I correct about that?
That's correct. So I've had some really nice progress with using the targeted fat loss with the cryotherapy, localized cryotherapy. I call it cryo contouring. I think people benefit from it in two ways. Like there's some people who are trying to do lifestyle changes and not seeing much progress, and then the perception of progress and change can be really powerful to help kind of move things along. And I think when you can see change, it's really motivating for people to start to, okay, I can't keep going on some of this diet modifications, or I do want to keep working on moving. And then I kind of think about it as a snowball effect. So if you see change, like my stomach, I don't really like that, or my thighs, it keeps people motivated to keep going. And then I also have a group of people who are also like, I really am unhappy in this one area that I cannot seem to change no matter what I'm doing. And it's frustrating. And so again, it's a way to kind of start to create change with it. So I use the localized cryotherapy. I get direct feedback on the skin. This is essentially like what it is here. I don't know if you can see that very well. And then I have carbon dioxide tanks. And so it brings cold air. And so I have direct feedback as to what skin's doing. I try to pull temperatures down to low 30s because that's where it's really most effective for fat loss. Upper 30s and low 40s is what I use for pain. But if I really want to work to destroy fat cells, that cryolipolysis is I'm going to bring it down to low 30s, and then I combine it with the lymphatic drainage. I think where some of these other brands get it wrong is they're not combining the lymphatic drainage with it, because if you're going to say that you're destroying fat cells and then the lymphatic system will help pick it up, well, why aren't you combining lymphatic drainage with it and really enabling the body to be successful with it?
So do you find that the targeted cryo that you're doing is more effective or maybe more controlled, I should say, than the CBC?
Well, I think it depends upon, so the CBC, the whole body chambers, is that correct?
Right, yeah. I was going to ask him what it is too. I didn't know what that initial is.
Complete body cryo.
Yeah, I think it depends upon what your goals are. I see a lot of people who have had like Achilles injuries or sprained ankles. And so, I mean, I wouldn't want to get in a whole body chamber for a sprained ankle personally, but if you're a chronic pain person, that might be beneficial for you also. I think my issue with the whole body chamber is like, okay, we'll stand in here for 1 to 5 minutes. We'll see what you can tolerate. Go for it. Good luck to you. That's a big range, and it's, can be a little uncomfortable. Same with like the cold plunge, cold plunges can be great. The problem too is just kind of getting in there. And I think it depends upon what your goals are. Cold has been around forever. And so just kind of what your goals are therapeutically with it. I think if your goal is fat loss with the whole body chamber, I don't know, to be honest, I don't know what people are using it, if they're using that much for a whole body fat reduction. I don't, but I think I've had some really nice results with the targeted fat loss with the cryo contouring. Yeah,
I've not heard of the whole body for fat loss. I'm not saying people don't. One of my very first experiences with IV nutritional therapy, before we started doing a lot of IV vitamins in our practice, I went to an IV center in outside of Nashville, and they marketed theirs for fat loss. But what they did was they cooled the IV down. They stored them in the refrigerator at 45 degrees and then gave you basically a rapid infusion of a cold IV fluid. So of course I was kind of crazy and thought, how dangerous is this? Coming from a critical care background, I knew kind of the dangers, but I went ahead and did it anyway. And then I shivered like crazy. And so I was like, I guess this is the mechanism, because you're going to burn calories because you're going to shiver so much. But it was a terrible experience, and we definitely don't recommend that as a way of fat loss, but I can see where it might work from all the
Sure.
massive shivering that you get.
Yeah.
So maybe similar to whole body stuff, right? You get them shivering and maybe they'll lose some weight.
I mean, I recommend if you're looking for the cryo contouring, some people have done like 3 sessions, some people have done 7 or 8 sessions. So it really depends upon how your body's responding, lifestyle, and goals. But coincidentally, I'm a physical therapist, and I rent a room from some nurses who do IV wellness. And so I think there's a really nice synergy of what they're doing and also like what I'm doing.
What are some of the dangers of this? Let's just say somebody wants to order one of these machines, or they find something on Alibaba or Amazon and they're not trained on it. What are some of the risks and dangers that they could run into?
Burning someone. You can get some definitely like cryotherapy burns. And then, some of the general contraindications, like if you don't know what you're doing, the big contraindications of heart failure, kidney, recognizing things that are maybe outside your scope of when you shouldn't treat somebody. But the biggest one is just the burn part of it.
Like a frostbite almost, essentially.
Frostbite, exactly. You can create like a frostbite.
I was a little surprised I was reading a study from King's College in London, and it was talking about the percentage of frostbite, which was the whole body chambers. But they were around 20% of people in the study reported like some degree of frostbite. And I thought that's really high to be in an environment that was conducted as a study, so it was supposedly controlled by professionals, and to have 20% of the participants that had some degree of frostbite. And so I see on social media all the time people doing like plunges in their backyard. There are now these plunge tubs and things that people can have. And so I think a lot of times people maybe do more damage than good if it's not controlled.
And I personally like the localized cryotherapy because I can see exactly what your skin's doing. And if someone's uncomfortable, we can stop. I think it's a little harder to be in a tank and I think people always have this challenge mindset of like, okay, I got to do this for 3 minutes. I got to get to 3 minutes. With this, I can always see what your skin's doing and get that direct feedback. And so the whole body is different in that sense. And then like the plunges, I don't know. I think maybe I'm personally not a cold plunger, but go for it if you are. If that's your jam, do it. I think I personally have like PTSD I ran track and cross country at Iowa State. So the trainers would always fill up tubs with ice and we just sit there for minutes. And so I'm just like, ugh, I don't get into that.
Yeah, that sounds terrible to me.
Living on the edges. Maybe I'll just turn the shower cold a little bit. That's my wild.
Just before you got on, I said we're more of a solar plunge family here than a polar plunge.
To each their own.
Yeah.
So outside of the localized fat loss, do you do other forms of cryotherapy or cool therapy or other things that you offer with your lymphatic drainage for general beauty? Because you mentioned, and we didn't really get into it, your protocol for the face.
Yeah. So I work muscles of the face. I always start with like lymphatic drainage, opening up those channels to kind of let the face, the fluids flow more or less. And I do some sinus opening, work on lifting depressors, kind of sculpting through cheeks, going up into forehead, into scalp. And then I do a little localized cryotherapy. I really like to pull an iron into the jaw, more so I think what the kids call a snatched jawline. I've had some really great results with that, and working into like some of the muscles into the scalp work really well for face pain, people who carry tension through their jaw, teeth grinders. I've had some people who do Botox who also find this is a really nice adjunct between the two of it. I mean, people who've had, long like jaw surgeries, long-standing sinus issues. So I'll kind of combine it with that as well.
What would your protocol look like if you're doing like a lifting or a snatching a jawline with some of these techniques? How often do they have to come in for the treatment?
It really, again, depends upon what your goals are. So I have some people who come once a month and they're really pleased with that. I have other people who come every other week because they love it. If you really are going to get after remodeling the tissue, I usually have someone come every 7 to 10, 12 days, and then once a month maintenance.
Okay, that sounds
and then I also just, I'm going to be starting also post-operative plastic surgery, lymphatic work also.
Yeah, we know some practices in South Florida that really incorporate a lot of that as routine in their post-operative care, and their results are phenomenal. So I do think that places who aren't thinking about that maybe missing some opportunity to get those most optimal results.
Absolutely. It's super beneficial to help with inflammation response, pulling fluids out, allowing nutrients to come in, and really remodeling scar tissue as well, as it's indicated timeline.
Kind of a fun topic. I know this is, important to you because we met you on the blocks. And so as an entrepreneur, talk to us a little bit about your challenges and the rewards of owning your own business now. I mean, you worked in a large healthcare system for many years, and so now you're kind of out on your own running your own business, which has so many rewards, but also so many challenges. So what have you found the most rewarding and the most challenging of being a business owner?
So I've been thinking about doing something like this since 2007. When I was in physical therapy school, I graduated in 2008 from University of Iowa. And so I didn't really take the plunge with it until, no pun intended, plunge, until 2023. So initially I was trying to figure out how to get people in. I had a lot of early success with that, I would say. And so now I've been in my business for 7 months, I think is what it is. And now I'm trying to figure out, okay, how can I grow also, and the strategic growth with that of hiring someone, expanding my space, training someone. So that's where I'm at now. And then right now I'm just trying to lay the groundwork also as I grow to kind of create, traction to help keep pulling people in and meeting with people. And Des Moines is a really great town for like word of mouth, but ultimately I'd love to be able to expand beyond Des Moines and have more of a franchise concept, because to your point, I think having well-trained individuals with a good background in anatomy and healing and post-operative and muscles is a really good skill set. And so finding those people and building the structure in order to do that.
We've been there, and like it seems like we'll be caught up, and then you have growth and you're back faced with the exact same challenge again, which is not a bad thing. When you have a plan and you reach your goal and you have to set another plan, that's what this business is all about, right?
Totally. Making changes, trying, testing, making changes, and then keeping that pattern moving forward. Like right now, I think I have I'm booked out for 3 weeks. And so, which is great for me, but also if I want to keep pulling new people in and growing, that's what I need to find more spots. And I'm also working on some other things of like an online video platform, and then manufacturing like a gua sha and oil and instruction with that too, because that can be a great thing for face and scar and instrument assisted soft tissue. So the time to get all that into.
Yeah, I think, being a business owner, transitioning from working for someone, one of the hardest things for me was realizing how many hours that it takes. You work more hours per week than ever at another or traditional job.
Totally.
But it's also very rewarding when you can see, kind of your vision come to life. And so that's really exciting and fun.
Super fun.
So what recommendations would you have for someone that's wanting to try cryo? Like what are some things that they should ask their provider, or how do they go about vetting their provider? What are your recommendations?
What kind of equipment are they using? And then do they have, if you're uncomfortable, are you able to stop? And also what their background is. I think there's a wide variety of people and backgrounds who are using this sorts of equipment. I'm personally am one that I hang my hat on someone who is well-trained and has a good understanding, because, there's a lot of things out there that you don't necessarily need to be licensed for, but people are doing, or that they're doing without being licensed for. So I think anyone who has a good medical background is key to do before doing anything.
Yeah, I think probably like anything else as researcher providers. So we talk a lot on our podcast and in our practice about making sure that, in our practice, in our mission statement and everything that we do, safety is kind of our number one priority. Mm-hmm. And I think that's really what we try to educate patients on that listen to us anywhere they go. Research your provider, make sure that they have training. Because like you said, there's some places that don't require licenses or some professions that are not licensed professions, but they can do a lot of advanced procedures. So research, what is their training, their expertise, their experience. And it's not that we all have to start somewhere, but, as a patient, make those informed decisions and educate yourself about your provider. So, thanks so much for taking time. I know you're super busy, and we could not thank you enough for taking time to be with us today. Any final thoughts or words you want to share with us on this cryo-wellness industry and where you see it going?
I think, in my opinion, I think some of this non-medicinal, non-pharmacological methods, they're going to kind of continue to grow as people are seeking out more holistic options in their health. But I think to each their own, no matter what route you take. I think especially in terms of like a pain management, with terms of lymphatics and the cryotherapy and the cryo contouring, people are going to be seeking more of those holistic options. So that's where I think things are going to go.
Great. Well, we will certainly in the links below and on all of our different channels, link them to you so they can check out more about CryoWellness in Iowa. We'll try to find somewhere in this local area and convince Jerry to go and do a polar plunge or a whole body one, since that's what he seems to talk so much about. And we'll post that with it also, maybe.
That sounds like fun.
Well, when you guys are in town for Christmas, let us know. Maybe we can do dinner.
Oh, that'd be so fun. I'd love to see y'all for dinner.
Yeah, sounds good.
We'll be down there over Christmas.
That would be perfect. Well, thank you so much for joining us today. We really appreciate it.
Thank you. Good to see you all again.
Thanks, Krista. Thank you guys, everyone, for tuning in for another episode of Beauty in the Brain. We look forward to seeing you next week.
See you soon.